Methodist Hospital of Sugar Land not only offers top-notch medical services, but also learning events, like this Stroke Awareness Clinic by the Medical Director of the Stroke and Neurohospitalist Program, Dr. James Ling.
Tonight, we are raising awareness about stroke symptoms and stroke treatments, and providing updates to the community regarding what a good primary stroke center can offer to help save lives. I've been trying to raise awareness about stroke for a long time, and really my discussion about stroke has remained the same for the last 8 or 9 years. Ever since the NINS TPA trial gave us some guidelines about treating stroke patients with clot-busting treatments in the first 3 hours in 1994, not much has changed about stroke treatment, except now in the last 2 or 3 years, there have been some significant changes in the way that we can deliver treatment that will enable us to provide even better care to patients.
All medical terminology aside, an acronym has developed to help the average person identify a stroke. FAST.
FAST is an important mnemonic to help remember the signs of stroke and how to respond. F stands for face, facial weakness, facial drooping. A stands for arm, or I suppose as a representation of extremities, weakness or numbness. S stands for speech, as in speech difficulties, changes in your normal speech patterns. And T stands for time. So if you notice F, facial drooping, facial changes, A, arm weakness or numbness or leg weakness or numbness, S, speech difficulties, then T, time is of the essence, and you have to call 911 because you may be experiencing the symptoms of a stroke, and early intervention may help reduce any kind of health impacts. Traditionally, early intervention for stroke has fallen within a 3-hour window. And that's still important to remember, that the sooner you respond to get diagnosed properly and get treated for a stroke, the less of an impact it can have on your long-term recovery and your overall health. But now, I think stroke centers that are certified with high quality should be able to offer a broader window of treatment opportunity to be able to save even more patients. Not just because 3 hours, of course, is an important window to remember, but with new evidence, we are now able to offer treatment to some people who are 4.5 hours after a stroke. And so that gives us even more time to help people who may not have recognized the symptoms soon enough. And up to 6 hours, we may even be able to provide treatment to extract a clot, for instance. But regardless, what window you fall in, it's always important to try to get into the hospital as quickly as possible to get diagnosed properly, because there are so many complicated issues regarding stroke treatment that have to be initiated as quickly as possible.
For more information, go online to the National Stroke Association at stroke.org, or for future hospital events, go to houstonmethodist.org. For Healthwise, this is Randall Williams.